Good morning, everyone. Welcome to your September CE. While we are giving everybody one more minute to log in, I'm going to go over a couple of housekeeping items before we get started. In order to receive your CE credit today, for today's course, you must be clocked into this webinar for a full 50 minutes, and you're required to answer polls throughout the webinar. So we'll stop the webinar about 15 and 30 minutes in, and we will launch a poll. You'll be required to answer those questions and submit your responses. If you have any questions for today's presentation, make sure you submit them in the chat box, and we'll make sure we cover those towards the end of today's presentation. Today, our webinar is being presented by Ken Spencer, President and CEO of HR Service. Ken brings to us over 30 years experience in HR compliance and benefits know-how. He holds a master's degree in HR management from the University of Utah and is SPDs certified. Ken, I'll turn the presentation over to you.
Great. Thank you, Amanda, and welcome everyone. You know, going through preparing this presentation to talk on top 10 compliance issues, it was difficult coming up with just the 10. I probably could have done 20. Compliance is a very big topic, and there's just so many things to cover and talk about. It's a good thing we're doing this in the morning when you're fresh, because compliance can put you to sleep as well. So, but we'll try and make this as exciting as we can. Well, I think we all understand how critical compliance is, and I'm going to focus today mainly on benefit compliance, because I know we have a lot of you who work as benefit brokers and setting up organizations on medical insurance and other group plans. So that'll really be our focus. But as you can see from this list here, there are a lot of fines and penalties. I've only listed a few here, you know, and you can see some of these are pretty hefty. So organizations who choose not to be compliant take risk of receiving these kinds of fines and penalties. We believe under the Biden administration that they are going to be increasing the audits that they take. They tend to take a stand of doing more enforcing than the Trump administration did. So I think you're going to see a lot more audits coming about. Well, the first one I'm going to talk about in terms of compliance issues and challenges is missing summary plan descriptions. ERISA law requires all group plans to provide participants with a summary plan description, or some may use a summary plan description wrap document. We'll talk a little bit more about the differences between the two. So it doesn't matter if you're a group of 2 or a group of 2,000, everyone is required to receive these documents. A lot of people get confused about, well, doesn't the insurance company do this? They don't, you know, so that's an error, a common misunderstanding is they don't have that. Just a little bit, I think most of you are probably familiar with ERISA, but ERISA stands for the Employee Retirement Income Security Act, and this was put in place in 1974. Initially, it was there to cover primarily retirement plans, but they've added in health and welfare benefit plans now. It does not include government, schools, and churches, so those are all excluded from ERISA. They don't have to provide the summary plan description document. It does provide the ERISA oversees fiduciary disclosure and reporting requirements, and is governed by a division of the Department of Labor called the Employee Benefit Security Administration, or EBSA. Let's talk a little bit about the summary plan description. So this needs the summary plan description does need to have a plan document, and the summary plan description needs to go out and be prepared and given out to all participants. It is more than what comes from the insurance company. It is not provided by the insurance company. In fact, there's a whole list of missing information that's typically not included in what you get from insurance companies. So like I mentioned before, a lot of people will use a summary plan description wrap document, where a wrap document will pull in the missing insurance company stuff, and they'll cover all benefit plans, medical, dental, life, disability, and wrap around everything inside, including all the ERISA required language. So it becomes a common technique, an easy way. Organizations could separately just do their own summary plan description for each benefit individually. Again, the common approach is to wrap it and do one. And you know, so a lot of them will do that. It does have to be given out to participants, new participants in the plan within 90 days of them joining the plan. We have 120 days if it's a new plan, newly established plan. And then it should be redistributed to all participants at least every 5 years. There's usually changes all the time. So we recommend people keep their summary plan descriptions or the wrap documents current and up to date, so they're providing all new participants with a current, accurate document at the time. So number 2 challenge and issue in compliance is missing employee notices and disclosures. There's a lot of disclosures that come into place here. Let's talk about some of them. Now, a common one I think we're all familiar with is a summary of benefits and coverage. Now, that one is provided by the insurance company, and typically they'll provide it to the employer, or it might be you, the insurance broker, that's getting it out to people. So you got to make sure that you get it and get it out to everyone. So critical there. We've talked already about getting out the summary plan descriptions or the wrap documents. There's also what's called a summary of material modification. I'll talk a little bit more about that, but anytime there's a change in a benefit that's a material change, like its benefits go up or down, there's a summary material modification communication piece that needs to be pulled together. And then there's probably the biggest area that people miss out on is these multiple notices: CHIP, women's health and cancer, newborns, HIPAA, Medicare Part D. There's a whole bunch of notices. Let me show you a little bit more on that list. There's a lot of these other notices. Some of them should go out every year. I think we're all familiar with COBRA, and you've got your initial notice that goes out right when they join the plan, and then there's a qualifying event notice that goes out if for some reason they've left the plan. We've got the CHIP, which is the Children Health Insurance Plan notice. There's Mental Health and Parity and Addiction Equity Act notice. That one only applies if they've got 50 or more employees. You get your newborns, women's health and cancer, patient protection, HIPAA, wellness program if you have a wellness program in place, grandfather plan notice if you have a grandfather plan. I don't know that there's too many that are surviving grandfather status anymore. Most of them have made changes and things, so there's still a couple hanging around out there. And then you've got Genetic Information Non-Discrimination Act, Family Medical Leave Act, Uniform Services Employment Reemployment Act, Medicare Part D, Special Enrollment rights, and of course, Health Exchange Notice. So like I said, there's a lot of notices that come into play there. A lot of different ways that people may get these out. Some of these may be included in some of the insurance information, but I wouldn't assume that. I'd make sure that they're all covered. We like to take the approach of, we've created a tool that pulls in each of the notices all in one that they send out to participants each year. So, kind of one year done approach, but lots of ways to get these all out to people. Well, the third compliance challenge that we have is missing the summary of material modifications. So again, a lot of people aren't sending out or communicating, and that's one of the things that the Department of Labor does audit when they come in and do an audit. They ask for those and look for those. Just a little bit more on what a summary of material modification is. There's really 2 types. There's a summary of material reductions and a summary of just the modification only. So the material reductions, this is where a benefit either is eliminated, reduced, like increasing premiums, increasing deductible, increasing co-insurance, reduces the service covered, establishes new conditions. Anytime you have that kind of a change, you really should provide a 60-day notice when possible. Sometimes it's hard to do that, like right at open enrollment, and you may not know until last minute, and here you are. That's a little bit more allowable during open enrollment. But if you're making changes mid-year or even terminating a plan, you always should give that 60-day notice, and then provide that summary of material modification communication piece that goes out to participants. So the other type is a material modification, and this one there's a little bit more time, so this kind of change should be changed on your summary plan description or your wrap document, and then you actually have as long as 210 days after the end of the plan year to communicate and get that change and that information out. I usually don't recommend you wait that long. I mean, if you've got the change, you know what it is, communicate it to people and let them know. Well, the fourth one, fourth challenge we have here is the notices are not delivered correctly. So we've got all these different notices and communication pieces that need to go out, and often they're not sent out to participants in the correct format. There's a number of ways that you can send these out. So the first one is, of course, I could mail them to participants. So I can mail the notices. If I'm doing that, I ought to send them in some sort of a first-class format, so I can I know I'm sending it to their last known address, and then I have evidence and records to show, be able to prove that I send it to them. Of course, I could also just hand it to them. So like during open enrollment or whatever, I could hand them these notices, hand them this information. If you're taking that approach, you want to make sure you have a way to obtain some sort of a receipt or evidence that shows that you handed it to them. Again, these are things that ERISA is always looking for. If they come in and conduct an audit, they're looking for, who was given what and when were they given it. And so we've got to make sure we have tied that into your system of managing compliance. You can also post to some sort of an intranet, or maybe you have a tool like Employee Navigator or Ease or some other system, or HR Service. We have a tool where you can store and deliver the document. So it works fine to post it somewhere and then have people go in, as long as you still have to separately notify them. So you have to communicate to them and let them know, here's where that is, and here's how you access that. And then they need to be able to have access and have the ability to be able to go in and reach that document. So that probably won't work well if you're at a manufacturing plant, have a lot of employees who don't have a computer or whatnots. Now the other thing you could do is do it via email. And sometimes that only works if they have a work email, or you can send it to a personal email as long as you obtain written authorization. So there again, that's something else you've got to track and keep on file that shows, yeah, they gave me authorization, here it is, and now I'm communicating it, sending it that way. Often you see a combination of the two of these, where they have some place where they log in to see the information, but they email notifying them. So again, it's important to make sure that we're delivering things correctly.
This is a great time to stop and launch our first poll. So if everyone will pay attention on your screen, we'll be launching our first poll. Are you currently using a compliance checklist with your clients and prospects? Just select yes or no, and it will register you as. Leave this up for about 30 seconds. We only have about 8% who have voted, so make sure that you guys are answering the poll. Okay, about 5 more seconds and we'll close the poll. About 83% in. Perfect. Everyone has answered. Thank you so much, you guys. It's about 50-50, Ken. About 50% of people are using a checklist and 50% are not.
Awesome. Well, and you'll see in here, we do recommend the checklist because it's hard to manage all of this information inside of here, and managing your compliance. Well, the fifth item is a lot of people are not meeting their fiduciary responsibilities. Let's talk about some of those. So employers who offer even just a medical insurance, for example, they have various responsibilities. They have to look out for participants' rights. We've got to make sure that if anything they're doing is fair and financially sound, prudent and honest with their communications and how they're handling and managing it, no conflicts or conflicts of interest. And then there's various reporting and disclosure, some of which we've talked about, and documentation of these and their fiduciary responsibilities. Some folks might even need to have a fiduciary bond, and that really only applies if there's funds that could be lost and they have the control over those funds, like if there's cash or checks and deposits, and they have the control and power to transfer that information. If they do, then they actually need a fiduciary bond. But most folks are just paying directly to providers, and if that's the case, then they don't need a fiduciary bond in those instances. Another challenge that we run into is that people aren't meeting the reporting requirements. So there's a number of areas where we have various reporting that takes place. If we look at, let's go through some of these. So the first one is we've got Form 5500. So Form 5500 applies if I have 100 or more participants on a plan at the beginning of the year, then I have to submit Form 5500. And that goes into, when I submit that in, I could submit it in separately for each benefit where I've hit that 100 or more, or if I'm using a summary plan description wrap document, then I could just submit in one 5500 and using the details on that wrap document. And I might submit in Schedule A's for each of the various benefits, but I just submitted one. That's kind of a double-edged sword there, because if I have other plans that I don't have 100 or more, I might be still including them in that 5500. But I do believe that most people do tend to err on that side. It's more simplified. It's easier to just do one under a summary plan description wrap document. So I think you find more people that do it that way. There is also a summary annual report. So the summary annual report goes out to all participants in the plan that communicates various information about the finances and the funding, some of the basic summaries of information that's gone to the 5500. That does go also out to all participants in the plan. Then of course we have the healthcare W-2 reporting. I think everyone's familiar with that. If I have 250 or more W-2s the prior year, then I have to include it on my W-2s. And so if you have anyone that's that size, you want to make sure they have that included in there. And then of course we have our ACA reporting. So ACA reporting is required for anyone who's an applicable large employer. So I'm an applicable large employer if I had 50 or more, or averaged 50 or more full-time equivalent employees the prior year. So if I look at the prior year and I hit that, then I all of a sudden have to meet the requirements of the Affordable Care Act, and then I have to report on employees. So if I'm an applicable large employer, I've used Form 1095 C and 1094 that goes, or the 1094C is what goes into the IRS with copies of the 1095s. This also applies for self-funded plans. So if you're doing any self-funding and you have less than 50, you still have you have to submit a report into the IRS. Here you'd use 1095B forms, the B forms going out. So again, that's a common problem. A lot of folks are missing some of their reporting requirements. Huge fines and penalties if you're missing these and not taking care of it. If we move on to number 7, not meeting IRS requirements. And there's a number of things here that come into play, such as the documents that are required, the non-discrimination testing. I have certain requirements of participation where I can't, I have to have a qualifying event to let somebody on or off the plan and make sure I'm managing and handling that correctly. So there's a number of tax favored plans that where this comes into play, and I think you're probably all familiar with this. Certainly retirement plans like a 401k, medical, dental, vision, voluntary plans. Anything I'm doing on a pre-tax basis would fall under this. Flexible spending accounts, health savings accounts, health reimbursement accounts. A lot of times, folks, if they don't have a full flexible spending account where I've got child care and uncovered medical included, I might just use a premium only plan document. So a lot of we still find a lot of companies who don't have that in place, but they're allowing employees to participate and pay for premiums on a pre-tax basis without having that document, and they're in violation of the IRS law, and they actually would receive fines and penalties and may have to back pay taxes and such if they don't have this. So it's important that they have either a premium only plan, sometimes called a POP document, or a flexible spending account, a full flexible spending account document. Either would work as long as they're defining in there the premiums. And it is very common that they're taking place that way. And then there is non-discrimination testing. I'll touch a little bit on that. I'm not going to go into the details of it, but any of the plans that fall under section 125 or 105 are subject to non-discrimination testing to make sure they're not favoring the highly compensated or business owners. So here's kind of that, some of that list. I mentioned I'm not going to go into a lot of detail on how the non-discrimination testing works. I really would put you to sleep if I did that. But please know that there are some areas, you know, we have to look at it for premium only plan documents. We have to look at it for flexible spending accounts, dependent care, HRA, FSA, self-funded non-discrimination testing plans. So any self-funded plan, we have to test the full plan to make sure it's not favoring highly compensated folks in terms of eligibility and participation and such. The fully insured plans they haven't really defined non-discrimination testing there yet. So we still have a few people that, you know, where they can have different divisions paying more for, say for executives than they do for non-executives on plans. You can still get away with that a little bit, but we keep thinking they're going to define it. Who knows? Maybe the Biden administration will. They started talking about this back in 2012. I mean, you know, so this has been going on for a long time. Certainly 401k plans, there's a non-discrimination test that has to take place there. Now, we recommend that they test right at the beginning of the plan year so you know when you're setting up your plans, do I have discrimination problems here or not? Solve it in how you're setting it up and communicating it so you don't have problems. You might even check it partway through the year, and then you'll do that test at the end of the year. When you're doing the non-discrimination test, it's not something you submit into the IRS. You just keep that on file to demonstrate that you're meeting those requirements. Again, this is if the IRS or when the IRS comes in and audits your clients. So number 8, not keeping good documentation. So this is a common challenge. We have a lot of folks that a lot of employers, they just kind of have all these benefit plans, but they don't realize they need to be able to demonstrate and prove how they're handling things like the notices going out and how they're communicating their benefits and get somebody that's eligible to participate and being able to demonstrate that they offered and allowed them to get on a plan or not. So if you look at this list, here's a few things. I'm probably missing some. I was just brainstorming last night, thinking what's some common things they want to make sure they're tracking. One of which would be new participants where they're offered coverage. Well, typically we have an application we have them fill out for the various plans, but if they're waiving coverage, I would always make sure I obtain a form demonstrated with them indicating that I've waived or I don't want to participate. Because you never know, you might have that risk of someone coming back and saying, hey, you never offered this to me and now I have cancer and so you're gonna have to get me on this plan. So make sure you can prove that you offered it to them. Same thing with tracking when somebody comes off a plan, so terminations or any qualifying event. I would make sure you've defined clearly what that qualifying event was. You might even have some evidence, proving that they had that qualifying event. Not always exactly necessary, to have the evidence before you allow it, but usually it's good to, build that documentation. We talked a little bit about summary material modifications. Keeping track of them and having them on hand is important as well. Then we've got, of course, all the notices we've talked about, summary plan descriptions. Make sure you can track who was given what and when were they given it, and being able to communicate that to an auditor if you ever have to. Changes to plan documents, your summary plan description or the plan documents that kind of change, you should save and keep a history of that. Changes in premium and cost sharing, your ACA reporting, keeping copies demonstrating that you met those requirements. It really could be any auditable item from the Department of Labor, the IRS, or Health and Human Services is another group that might audit you as well. So, just make sure that there's some sort of a documentation trail where you can demonstrate, who was given what, whether it's offering COBRA, distributing notices, SPDs, or summary material modification, some way that you can prove to that outside party, that you've handled that. A lot of ways that you can file these things. You may file them, in fact, most of us are trying to get away from too much paper, but there's still some paper elements. But over time, I think we'll all be digital, electronic. But you still have to organize it, have a way to be able to find things. So consider filing by topic or category. You might file by due date, by client size, or maybe just keeping a Department of Labor audit trail information file. So again, lots of ways to think about how you pull that information together.
Hey Ken, this is a good time to launch our second poll. So I'm just going to go ahead and do that. So you guys will be launching the poll onto your screen now. Do you help your clients with Section 125 documents? You can answer yes or no, and that will submit your vote in. Make sure that you're answering your poll today. I'll leave this up for about 30 seconds. Ken, while everyone is working on the poll, we did have one question come in. The question reads, who does the non-discrimination test? Is this something you hire an outside person to do?
So while you're completing your poll, I'll go ahead and answer that question. So the non-discrimination test, the responsibility is to the employer. They're the ones that have to make sure it's done. Most are not really qualified or know how to do that test. So they'll use some sort of a third party like HR Service or someone else that may actually review and complete that test for them.
Perfect. Everyone has answered the poll, so I'll close and move into the presentation. 75% of participants in the conference today said that they do help with Section 125.
Outstanding, thank you. So the number 9 challenge is they don't know if they're compliant or not. A lot of employers are just out there kind of operating in a bliss, waiting for an audit, not knowing, I don't know if I'm fully compliant or not, which is a huge opportunity for you as insurance agents to step in and help them to make sure they are compliant, and it becomes a means of setting yourself apart from others. But this is a real challenge. There's a lot of folks that just don't know if they're compliant or not. So let's talk about a few things they could do here to get on top of that. Certainly they could go hire an attorney and get some legal counsel to come in and look at and review, and you could do a full audit, some sort of a compliance audit, and see where they are and how they're doing there. You subscribe to some sort of a legal update service that keeps them up to date and helps them understand what their requirements are, tells them what they need to do every month and such. There's benefit compliance checklists, and I think we did a poll on that, and I was happy to hear that a lot of you are using checklists. Certainly you could hire or become an expert yourself. I'm going to take just a second and divert out of our system here, because I wanted to show you there's a lot of folks will use a checklist. We have a tool that we would make available to you really at no cost to allow you to conduct a compliance audit for clients. And so I'm just going to show you really quickly what that would look like. So if I were to go into, it's called our Compliance Login Center, but inside of here, there's a tool that the one that we'd make available to you, you'd access differently than this. But this is a view of a client, but we have a compliance assessment tool in here where a client can go in, or you could do this with a client as well. Let's say, sorry, it logged me out, so I gotta log back in here. But you go into this compliance assessment tool, and once you're logged inside the system, the tool is customized where it only asks the questions that apply to that employer based on their size, if they're a government entity or not. And it customizes the questions. So you see in here, it covers all the key areas, like here's Affordable Care Act, COBRA, documentation, the notices tracking, which notices are going out, are they doing this or not, are they uncertain if they have, do they need a fidelity bond, HIPAA and high tech. MIWA, if you have the multiple employer welfare arrangements, medical loss ratio, cafeteria plans, Non-Discrimination Testing, 5500 reporting, SARS, summary material modifications, summary plan descriptions, medical expense on W-2. You know, if you can get people that are doing all of these things, they're going to be compliant. But this gives them a way. They go in here and they say yes, no, or I'm uncertain. And then when they're complete with that, they hit this dashboard report, and then this tool will actually tell them exactly what compliance areas. So it gives them a score, assigns them a score, a risk score, and then it tells them exactly, defines the exact compliance areas that they need to complete down below. So it's a really cool way to deal with and manage compliance. All right, great. Let's go. I'll go back to our slides here now. So the 10th item is a lot of folks are just not prepared for Department of Labor audits. So this is a challenge. I mentioned that the Biden administration is gearing up. They're going to be conducting more audits. We've seen audits taking place for even companies as small as 15. That's odd. Usually they're focusing on the larger ones, but a lot of things might trigger an audit. If there's a complaint, you know, by an employee, then that could trigger it. Also, you could just be randomly selected, you know, and so that does happen. You could also be audited based on the reports that you're submitting to the IRS, your 5500s or your ACAs. If you continue to have errors and problems and such, you might prompt an audit that way. But you know, I mentioned they've increased the frequency of their audits, but they're looked for. Here's some of the things they look for when they do an audit. They're looking for the summary plan descriptions of the wrap documents. They're verifying have you given out the notices. They look at trigger notices, trigger event notices like COBRA and HIPAA breaches and those kinds of things. Have you done your 5500 reporting? And they look at the timing of that. Are they on time? I mean, for every day that you're late on that report, I mean, there's a hefty fine. Have you been in compliance with the Affordable Care Act? So, you know, again, these are some of the very highlight here. If you ever want to see, I've actually got some audit letters. We've had a number of clients that have gone through audits, you know, even using some of our documents and things. And, you know, again, being prepared is huge, really helps to get through that. You know, so a couple things to think about if you're audit ready. Determine the employer's requirements, you know, so make sure what applies to them, and then follow the law. And you could do that with some sort of a checklist or like that compliance assessment tool that I mentioned previously. Assess where they are now and doing some kind of an audit or whatever, and then begin to make the corrections and make the changes and updates that are needed. Creating the required documents, whether it's a summary plan description or a wrap document, premium only, having all these documents, having their notices in place. And then providing participants with those notices, and then being able to prove who received what when. You know, keeping record of that. You know, who was sent what and when did they get that. Of course, you know, meeting the various reporting requirements that we've gone through already, 5500 or ACA and such. And then, you know, again, keeping some sort of a you know, good document trail also of your summary material modifications. And then having a record keeping system, you know, that shows, you know, tracking such things as the premium contributions, payments, payment information, reporting documents, you know, and then making sure you're compliant with all the COBRA requirements as well. So if you're doing all of those things, you're going to be sitting pretty good. Well, that was the key 10 things, but now I'm going to kind of shift gears and talk about kind of some in general things that you can do to help make sure that you're compliant. There's something about compliance. I don't know what it is that, you know, we even say the word to employers and we all kind of cringe, you know, because it's a bit of a pain. It can be daunting, overwhelming. There are so many requirements. They're constantly changing, and you know, it just becomes a real challenge. But if you keep up on these things, and I'm going to show you a few techniques to kind of make this easy for you and for your employers. big picture view of everything. If you're looking at compliance, we've talked about pretty much all of these areas already. You got your fiduciary responsibilities, your various notices that have to go out, non-discrimination testing, the setup and termination of the open enrollment and the qualifying event and the Family Medical Leave Act and all of those possible areas of benefit compliance. You got medical loss ratio refunds, your various reporting, 5500, SARS, W-2 on premiums, ACA reporting, etc. HIPAA compliance. We didn't really go into a lot on that, did we? But we got to make sure that we're managing the protected health information. That would be another, could be almost a separate compliance challenge, because a lot of employers are not effectively handling that. Even by virtue of just offering medical insurance, HIPAA applies to them, and they have to make sure they're handling the protected health information so that it's not being improperly exposed, or that they have business associate agreements with anyone who has access to their HIPAA information. Even folks like you, where you might be helping with claims or having access to some of the confidential information that's tied back to an individual, you should have a business associate agreement with each of your employers. And then of course, COBRA. So I probably may be missing a few little minor things, but that's kind of the real big picture there. Again, if your employers are compliant in all these areas, they're doing really well. So how do you keep up on everything? It's just hard to organize and make sure you've got all of these things together. Some of the things to think about is getting really clear about who's doing what. So as you're working with your employers, are there parts of this that you're going to assist with, or are there parts that they're going to help with? Ultimately, it's the employer's responsibility to be compliant. I would make sure that they're very clear on that you're not taking their responsibility. I would never recommend that you fully take that on. However, you can help with compliance, and a lot of brokers do. If you're going to take that approach, just be clear with the parts you're helping with or what they're helping with. But then we recommend some sort of a hold harmless agreement. So have something with the employer that acknowledges that you may assist or offer solutions, but ultimately they're responsible for their compliance. So have them hold you harmless, that they understand they're responsible, it's not you. Here's an example of something. We'd make this available to you if you'd like to have some sort of an acknowledgement. You have them sign. I'm happy to provide one for you. But here's an example. So you might have I acknowledge that my below insurance broker informed me of, and the various things that you inform them of, the responsibilities. If I receive assistance from my broker, this area, understand it's solely our responsibility, and I agree to indemnify or hold harmless my insurance broker or agent. So again, it's just a good precaution. Now, I want to be transparent. I've not had this tested. We've had a number of groups that have used this. I've not had this go to a court, but I believe it helps. I can't say that it guarantees. I mean, if there's problems and they're coming at you and trying to say, hey, you're responsible, or you didn't do this for me, I mean, this can help as long as you've acknowledged and demonstrated that, hey, you own your compliance, not me. It's also important to have someone each of the organizations who owns compliance and is responsible. They should really have the commitment of senior management to let them do the things they have to be compliant. Sometimes that's the challenge they run into, is they may want to do it, but the CEO says, well, no, I'm not going to do that. I'm not going to spend that money. I don't want to do that report, or why do we have to do premiums this way, or so again, they have to make sure that they understand the challenges if they don't, and why they want to make sure they're doing these things. How will you keep compliant? How will you keep them informed? And there's lots of things to think about here, but certainly, NAHU's a great resource, a compliance corner, HR service. We can be a great resource in helping you, through all of these things. Certainly all these things. There's other systems and programs out there like Checkpoint, SHRM, lots of things on the internet, state and federal access of information, lots of ways to keep up to date. And then just make sure you're keeping everything organized. Where's this information kept? Make it easy to find, easy to remember, having things saved electronically or having reminders and such in place. We talked about filing techniques already. you can't do everything all at once. Employers will get just overwhelmed, and you'll see their eyes glass over if you're trying to do everything. But plan it out throughout the year if you're going to guide and help somebody, with this, or making suggestions for them, so you don't overwhelm them. But if you think about it, there's certain times when I'd make sure COBRA is set up and put in place first and foremost, and they understand how they handle that and communicate that. There's really big amounts of risk if that's not handled. Affordable Care Act, or 5500 reporting, those big penalty items, make sure that they've got some way they're on top of and handling those things, and then just communicate. And then some of this can be handled and spread out over the year, as to when they're applicable. Like 5500s, for example, they're due the 7th month in which the plan year started. So if I started the plan year in January 1, they're due July 31st. So just plan out where you're communicating a month or two before. You don't want to wait until the due date and then go in and say, okay, it's time to do that report. And plan a few months ahead of time and prioritize, and that really helps them to get on top of and to be able to take care of those things. We talked about checklists, or using a tool like with us, and that's a great way to keep on top of what's applicable and what do I need to do and where am I at right now. Calendars are another thing that we recommend. So anyone that works with us, we provide a compliance calendar every year so they can kind of plan it out throughout the whole year. Then we remind them every month with a legal update and tell them what to do. So if you don't have those kind of sources, I mean, there's other folks like us, but again, that's a good thing to make sure that you have a tool where you're keeping on top of what's changed, state and federal, and as well as what things are due. I recommend too creating various handouts, things that you communicate out to employers to help make sure they understand the fines and penalties and the risks, to get them to take these things serious, because it's a challenge sometimes to get the attention of the employer and get them to take the actions they need to. Another thing is looking at compliance by size. So the size of the employer, there's different compliance requirements that come into play, whether if I'm under 20 or if I'm 50 or more or 100 or more, self-funded or fully funded. If you look at look at compliance through those eyes, it helps you to keep on top of that as well. And then I'd have reminders. Set these things automatically into your calendars. It's hard to remember everything, so tying in reminders. We have tools within our system that can remind somebody when it's time to send their notices, or remind them when it's time to do various reports and such. But find a way to tie in those reminder systems, because again, it's really hard to keep up on top of everything like that. We also recommend having written policies and procedures for how they handle and complete all these critical things like COBRA, open enrollment, their reporting, and FMLA, and all of these things. They can't just be, you've got to be very systematic and exact and make sure you're following the best practice and the requirements for all of these critical areas. So if they don't have something in writing on that, we recommend they have a defined process on how they do these things and form these things. I'm hitting a lot of material here for you today, so but again, we want you to walk away today feeling like, hey, I can do compliance, or I'm on top of this, or at least you have new ideas on how to help them be compliant, or to work with someone like us. There's some things that need to be handled every year. Your summary of benefits and coverage, the various notices that should go out every year, your summary plan descriptions, at least to new participants. You don't have to do a new summary plan description wrap every year, but if you do have changes in the plan, you need to communicate those changes with a summary material modification. And then you've got various reporting that may or may not apply based on the size of the group and how the benefits are set up, and then the non-discrimination testing. So again, these are things that need to be on top of every year. So again, at a glance, that gives you a quick view. I don't recall if Amanda mentioned this or not, but there are copies of these slides that you can download. I think she set this up right within the system. You can download it. If not, we'll make copies of these available to you later on upon request.
Yep, they are available in the handout section of your GoToWebinar along with today's course intro statement, so you can download this entire presentation right from the GoToWebinar.
Perfect. Thank you, Amanda. So we also have an ACA coming up on us here pretty quick, which is something you probably ought to be thinking about if you have employers that are applicable large employers. So they had 50 or more employees or full-time equivalent previous year, then that applies to them, or if you have self-funded plans. So you need to be thinking about that. You've got forms that have to complete, the 1095s, the C's or B's, and it's got to go to the IRS. The due date's January 31st, but believe me, you do not want to wait until January to be pulling these together. If you're using somebody to help with this, like HR Service or someone else, you got to be starting to make those arrangements and getting those things in place now. And this year, just so you know, we're hearing they're not going to allow that forgiveness provision. They've done that, every year, or even through last year, where they would allow little minor errors in documents and such, and they would allow a forgiveness. We're hearing they're not doing that this year, and we're also not sure there's going to be an extension of the due dates, which we have seen in years past. So just be aware, we're not thinking there's going to be those things this year. The Biden administration is being a little harder on the employers. So just in kind of summary and wrapping up here, if you have a centralized compliance system or way to manage and be on top of these things, a system to do your deliveries, to store your information, that really helps, and having a tool and such to do that. Look at how you're handling your client communications, how you're doing your open enrollments, the emails, the documentation, everything that you're sending out. And how that's going out. You can really get on top of compliance by doing things effectively that way. And then having relationships with certain partners, like someone like HR Service, it can help you and help your clients with all of these things and help with compliance and the notices and automate and simplify the whole process. And then just try to keep things simple. I break things down into small bite sizes, do a little at a time with the employers. Again, you overwhelm them if you try and do it all at once. So pace it out, put it on calendars, plan it throughout the year, and then get their commitments to follow through and do those actions, to make sure they're compliant. So what do you do if a client digs in their heels and they're not responsive? Is that your responsibility? Is that your problem? Really about all you can do is educate, communicate, and strive to help, right? If they're not responding, I would document what you've done and move on. So in some cases, some clients, you might want to actually have them sign something that you've defined the risks, and I mean, it's I don't think you can continue to harp on somebody. Actually, if you've done your due diligence, I document, communicate, strive to help, and and just remind them anytime you can. But I've had some folks say, well, maybe I'm not going to work with them if they're not going to do that. That's up to you. But as long as you've met your responsibilities, you've done your due diligence, your risk is minimized. But you might consider having them sign something, that acknowledges that you've communicated for them to do that and they've elected not to. So we've talked about the reporting requirements already. Keeping up on COBRA is also very critical as well. So I'm not going to hit all the details of that. Of COBRA is a whole nother topic, but that is another common challenge, that people are not fully managing COBRA. In most instances, we recommend that they outsource it, to someone like HR Service, so that they don't have to try and manage it themselves. There's just too many things going on and too much risk inside of there. So with that, Amanda, I'm going to switch it over to you. Did we have any other questions that have come in?
We have no additional questions. We do have one more poll. I'm going to launch that now. If you want or need more information on compliance tools for your business, please take the time to complete this poll, and I'll leave it up in about 30 seconds. While you guys are completing the poll, I want to thank Ken for his presentation today. Ken has also graciously sponsored this event. So if you could allow him a couple of minutes to talk about HR Service and the services that they provide to us. If you stay on for a couple more minutes, we would really appreciate it. Ken, we appreciate you providing us this valuable information. I feel like every time we hear a compliance presentation, no matter how many years we've been doing it, we learn something new. They're always very valuable. About 5 more seconds on the poll. We have about 90% who have voted. Make sure that you vote in on the poll, you guys. I'm going to close this in about 2 seconds. Okay, I'm closing the poll. It's 50-50. People want more information. So Ken, I'll turn it back over to you. Tell us a little bit about HR Service.
Great. Thanks, Amanda. And thanks, everyone, for participating today. So I'll just give you kind of a high-level, quick overview here. But, so HR Service, we help with human resources, compliance, and administration. And I'll show you what I mean by that. This is our contact information. You can check out our website at hrserviceinc.com. You can email us at solutions@hrserviceinc.com or call us 833-685-8400 extension 1. This is my personal email as well. But just to show you a couple of things. So when I say human resources, we offer various packages where one, we could act as an outsourced HR professional for someone. Or we have an HRE solution where they can use tools for like training modules, an HR compliance audit, handbook online, forms, documents, library, help desk, total comp statements, so they can sign up for it. We give you wholesale rates if we're running this through you. We can also help with any HR project like handbooks, compensation plan design, training, really anything human resource related. So we have that whole division for human resource management. With our insurance brokers, we really shine and help a lot with benefit compliance. So we have a tool and a system to easily create the summary plan description wrap document, summary material modifications, your notices, and really easily simplify and make that whole system work for your clients. We also help with ACA reporting and 5500 reporting, so all of those areas. And then we do benefit administration. So if you need help with your COBRA, health savings accounts, health reimbursement accounts, flexible spending accounts, or non-discrimination testing, we help in all of those areas. One of the things that's probably one of our most popular packages is this ERISA e-solution, because it's really inexpensive and it's a way to kind of manage that whole compliance. Everything we've talked about here today could be handled and managed within this tool. So they can very easily know where they are with their compliance with that assessment tool and track it and complete their compliance as it's done. We give them legal updates and reminders. We give them a calendar every month. We brand the updates to you. So we actually help build your brand and tying in your logo. We help with all their notices. We have a one and you're done system. The tool will send it, store it, and deliver it. We've got HIPAA toolkits. And then I mentioned the tool to create their summary plan description wrap documents and their POP documents and everything. And we have a storage vault where they can store their documents and can actually deliver them and demonstrate when it was delivered and who they were delivered to, all within inside of that system. And for those who want the HRE solution, I briefly mentioned this does give them a help desk, training videos online, a handbook online. They've got HR compliance assessment tool, total comp statements, legal library, tools and templates, all of those kinds of things. So that's a very high level overview. I'm going to just very quickly go into the system again just to show you a couple of things inside of here. It's probably logged me out again here. Let's see if it has. No. So inside of here, when somebody's set up on the service, this would be your logo that's inside of here. And then they could come in and then access these various tools. So if they had just the ERISA e-solution, they would only see these items here. And then they could come in here and they could go in this section and complete all of their documents. So they fill out the information about the company, and then that goes in and helps with all of their various employee notices. In that system here, it would generate their notices for them. In here, they could complete their wrap document information. Here, they can create their premium only plan document, and then they can actually store this information inside the document storage vault, which makes it really nice to be able to. I'm sorry, my internet at my home office here is a little slow, so it's not connecting me in as quickly as I'm going. But we have a document storage vault where they can store things and deliver the tools inside of there. That makes it really easy. But they could go into these things individually, the wrap documents. There's a tool to create the summary material modifications, and then it stores the documents, and they have a history there if they're audited where they can actually show those things too. And then there's they can go in and create their premium only plan document, HIPAA toolkit, so everything's inside of there. If they want the HR, then that could be added in here, and then they can go in here and easily create a handbook. We actually have an HR employment law compliance assessment tool, every kind of form document template they would need, legal library, total comp statement generator, job description tool, lots of training videos for employees and supervisors. So again, we're all about making compliance, HR, and benefit administration simple. So any other questions from anyone? Again, really appreciate the opportunity to have met you all and participated today. And if we can be of further help, you've got my contact information. So thanks, Amanda. I'll turn it back over to you.
Thank you, everyone. I'll go ahead and close today's session. It has been recorded, so I will make that available to participants. And I hope you guys all have a wonderful Friday.
Yeah, thanks, everyone.
Bye, guys.